If you thought the fight over what so many now refer to as Obamacare was over, it is not. It has simply moved to state capitals. While the Supreme Court upheld most of the Affordable Care Act, it is left up to states whether to expand Medicaid. Medicaid expansion is going to be one of the most contentious issues lawmakers wrestle with in Topeka and Jefferson City as their legislative sessions get underway in both states. Now, if you haven't been following the story, the Affordable Care Act expands Medicaid, the government's low-income health care program, to individuals and families making up to 138% of the federal poverty level. Now, under the act, the federal government would cover 100% of the costs of the newly eligible recipients for 3 years. And even after that, states would pick up no more than 10% of the costs. Advocates say it's a good deal. But on last night's The Local Show on KCPT, reporter Sam Zeff also spoke with critics who were worried about those 10% of costs and what those could mean for a state like Missouri into the future as hundreds of thousands of people are added to the Medicaid rolls.
I don't see how you can look at what the Hospital Association put out, and I've seen their study. And it's a nice study. It was put together at the University of Missouri. It's a great study. But you're looking at something, you're going to try to go forward 8 years and project something 8 years down the road. I just got out of a meeting about 2 weeks ago trying to predict the consensus revenue figure for the state of Missouri going forward 18 months. And we had a lot of discussion and a lot of discussion on what that's going to be. And that's an 18-month figure. And now we're talking, the Hospital Association is talking going out 8 years.
Hard to believe?
I think so.
And there's even less believing in Kansas.
The more that we start giving anything away free, in this case health care, the money that's going to cost is going to come out of school funding. It's going to come out of other social service programs. Or it's going to come out in the form of much higher taxes, which is going to have an economic impact of reducing jobs.
You can see the entire Local Show story on KCPT Sunday at 5:30 or on KCPT's YouTube channel. Let's start in Missouri, though. The governor says, let's do this. What about the Republican-controlled legislature, Steve Kraske?
Well, so far, a lot of resistance to going forward with this, but I just would add that the Speaker of the House, even though he has spoken out very strongly against this idea, he is keeping the door open, Nick, by the formation of a committee designed to look at different options going forward when it comes to shaping this package that might make it acceptable to Republicans going forward. So early soundings, it doesn't look good. It's going to be a very, very hard fight for Governor Nixon. One of the pivotal moments of his 8 years in office will be this fight, but it's going to be very tough.
Sam?
Steve is right. Although I think what the proponents have going for them is a ground game plan that is detailed and involves a lot of people. As we mentioned, it's the Chamber of Commerce is for this, the Kansas City Chamber of Commerce is for this, Hospital Association is clearly for primary care.
Because they're arguing this will also create jobs, aren't they?
Right, 24,000 jobs and $9 billion in the economy. Interesting thing about the Hospital Association, their ground game is planned out district by district. They can go to each representative or each senator and say, listen, Medicaid expansion means this to your rural hospital or this to your clinic. And they really believe that they can swing enough votes going district to district saying here's what's good about it and get this thing to pass.
Dave?
The biggest problem in Missouri, and it's also the biggest problem in Kansas politically, isn't really the facts and figures, because Sam's right. I think lobbying groups are sort of saying it would add X amount of jobs, this revenue wouldn't really cost you anything. The biggest problem legislatively is the visceral hatred of the Affordable Care Act. Logic and facts and figures don't really figure into the debate. I don't mean that in a pejorative way. There are people who just don't want to do anything that is seen as an endorsement of what they call Obamacare, and that's really the hurdle for Republicans both in Missouri and Kansas to get over.
So we talked about it in Missouri. So is that the same then in Kansas, you believe?
Yeah, very much
Steve?
so. But again, Governor Sam Brownback, a very conservative governor, has left the door open, hasn't closed the door to the idea of advancing and moving ahead with this expansion. Now, trying to pass something like this through that legislature, even perhaps more conservative than you find in Missouri, again, a very, very difficult task, Nick.
Okay. Sam? The benefits, though, I mean, we just talked about the critics there in your larger story that you can see again on 5:30 on Sunday from the local show if you didn't see that whole report. I mean, the benefits, though, I mean, obviously they're going to say these are going to be healthier individuals.
Yes.
It's going to benefit hundreds of thousands of people if they were on the expansion of Medicaid.
Yes.
They claim also it would increase the number of jobs in Missouri and Kansas, but the skeptics are still there that they don't believe the numbers.
I think that there is some of the non-believing, but I really believe it boils down to exactly what Dave said. There is a visceral hatred of anything that has Obamacare attached to it. I think that's going to be the most difficult hurdle in both the Missouri General Assembly and with Governor Brownback, who makes the decision in Kansas.
Is there more to it than that, Mary?
Well, I think that's the bottom line of it, but what they need to, as far as the backlash, but what people also do recognize, whether they state it or not, is that we have an awful lot of people who do not have health care, and it is extremely costly to the economy. People know that, politicians know that. So when they get pushed, they're going to have to